Hello, and welcome to Health and Wellness with Dr. Naeem. Today's topic is coronary artery disease, also known as CAD, one of the most common and serious heart problems worldwide. In this video, I'll explain what CAD is, its causes, risk factors, symptoms, diagnosis, treatment, and prevention. 1. What is coronary artery disease?
Coronary artery disease create a cohesive and immersive auditory experience.
That supply the heart, coronary arteries, become narrowed or blocked due to the buildup of fatty deposits called plaques, a condition known as atherosclerosis. This reduces the blood flow to the heart muscle, causing chest pain or even a heart attack if the artery is completely blocked.
2. Causes and risk factors. The main causes are linked to unhealthy lifestyle habits and certain medical conditions. Common risk factors include high cholesterol levels, high blood pressure, smoking, diabetes, obesity, lack of exercise, stress, family history of heart disease, unhealthy diet rich in fats and sugars. These factors damage the inner walls of arteries, allowing cholesterol to stick and form plaques. 3. Signs and symptoms. The most common symptom is chest pain, also called angina. It often feels like pressure, heaviness, or squeezing in the chest, sometimes spreading to the arms, neck, jaw, or back. Other symptoms may include shortness of breath, fatigue, especially during exertion, nausea or sweating. In severe cases, heart attack when blood flow is completely blocked.
4. Diagnoses. Doctors use several tests to confirm CAD, such as ECG, electrocardiogram, checks electrical activity of the heart. Echocardiogram shows heart's pumping function. Stress test measures heart performance under exercise. Angiography or CT scan shows blockages in the coronary arteries. 5. Treatment. Treatment aims to improve blood flow and reduce risk factors. It includes lifestyle changes, healthy diet, regular exercise, quitting smoking, and managing stress. Medications, antiplatelets like aspirin, statins to lower cholesterol, beta blockers or ACE inhibitors to control blood pressure, nitroglycerin for chest pain relief. Procedures, angioplasty with stent placement to open blocked arteries, and coronary artery bypass surgery, or CABG, in severe cases. 6. Prevention. Prevention is the best treatment. To protect your heart, eat a balanced, low-fat diet. Exercise at least 30 minutes daily. Keep your blood pressure, sugar, and cholesterol under control. Stop smoking. Manage stress with meditation, prayer, or breathing exercises. Coronary artery disease is serious, but preventable. Small lifestyle changes can make a big difference in protecting your heart. Thank you for watching. I'm Dr. Naeem, and this is Health and Wellness. Stay heart healthy, stay strong, and I'll see you in the next video.